This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, well, good morning, everyone who is here. So let's do a medical minute on a case we had. It was kind of interesting, something we don't see a ton. Sometimes we talk about. It was a 30-ish-year-old male who came in with a little bit of a interesting story. He said that he got in an argument with his girlfriend. He went outside for a minute, came back in, took a swig of the drink that he had left there, and felt an immediate burning in his throat. And his girlfriend kind of started laughing and saying she put acid in his drink and he was going to die. So an interesting situation. Don't try that one at home. So he came in fairly quickly, looked pretty uncomfortable, said he was spitting up some blood, said he was having a hard time swallowing. So we brought him into a room, kind of started his evaluation. So, the idea of caustic ingestions, can be either acids or alkali. In adults, it's usually intentional. Sometimes people try and kill themselves by drinking a lot of bleach or other kind of nasty household chemicals. Sometimes kids can do it accidentally, and sometimes adults can do it accidentally. The big thing we worry about is, those things can be pretty destructive to the esophagus. You can get perforation. You can get pretty significant burns. You can get bleeding. You can get airway edema and airway issues as well. And sometimes even when people don't look that bad, these things can be pretty nasty. And, you can imagine if you rupture your esophagus, it can be a pretty bad infection in your mediastinum. Sometimes these people need early surgery if they look really sick. Most of the times, as did this guy, the injuries aren't that bad and they can just be observed. They do get an endoscopy frequently, CT scans, to see how bad the injuries are. And then usually within 24 hours, if they're doing okay, they can start drinking and hopefully don't end up with some of the complications like chronic esophageal strictures, needing feeding tubes. But they can be pretty bad. There's not much we can do besides supportive treatment initially and getting the right testing done. There's no steroids. You don't want them to make them vomit. You don't want to, try to dilute it out. We just kind of observe them, treat them symptomatically, and then try and assess how bad the injuries are. All right, thanks, everybody.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.